My name is Christine Block. I'm a research scientist and I'm a licensed therapist. I'm going to talk to you about anxiety. Anxiety is a nervous system state. Fundamentally, anxiety is what ensures our survival and it's what keeps us safe. Without anxiety, we would not have survived as a human species. So we have to live with it. We can't get rid of it. Neuroreception is a process of how our brains distinguish whether we're in a safe environment or a dangerous environment, or even when our lives are being threatened. This happens automatically. We don't even have to think about it. You can think of it sort of as a smoke alarm. Your smoke alarm in your home is always working to detect smoke to alert you in the event of a fire without you having to sit there and watch the smoke alarm. It's working automatically. That's the way the anxiety works with our bodies. It happens automatically. We don't have to consciously be thinking about it. When our anxiety works for us, it's what helps us prepare. It's what helps us do our jobs well. It helps us prepare for an exam. It helps us do well at a job interview. When it's not working for us, we can get overwhelmed and trapped in a state of anxiety. An anxiety cycle is the cycle of anxiety where our thoughts and our behaviors reinforce the anxiety and it makes it stronger. There are lots of things that can contribute to being trapped in an anxiety state. A lack of sleep, poor nutrition, stress, not having our basic needs met, and trauma can all contribute to an anxiety state. Sometimes our jobs contribute to an anxiety state as well. Working in fast-paced environments where we're dealing with life and death situations such as firefighters, EMS, emergency room doctors, paramedics, rely on anxiety to do their jobs well. And without practicing exercises to release this anxiety, it can cause a chronic stress and keep us trapped in an anxiety state even when we're not at our jobs. In this video, I'm going to show you some exercises to rewire your brain and help overcome anxiety. First, I'd like you to ask yourself, though, what does anxiety feel like to you? It feels different for everyone, but most people report similar symptoms. Emotional symptoms that people report are an overwhelming sense of fear or a desire to get away, to run away. A sense of impending doom, sort of like you're waiting for something bad to happen. You don't know when or where it's going to happen, but you feel like you have to be on alert. A heightened sense of awareness of your surroundings. Sometimes mental confusion. Physical symptoms also vary, but most people report a rapid heartbeat. Some people feel like their heart is just sort of beating out of their chest. Shortness of breath is a common symptom, a choking sensation. Tightness in the throat and the chest, muscle tension, shakiness, tingling in the arms and legs. Sometimes people feel shaky and feel a little sweaty. The exercises I'm going to show you are going to help reduce your anxiety symptoms. And the exercises are based on something called proprioception. Now, proprioception is sort of the opposite of neuroception. Proprioception is our awareness of our bodies in our environment and the movement of our body. And I'll give you an example of this. Close your eyes. Take your index finger on either hand and touch it to your nose. So it's proprioception that helps us know where our nose is in relation to our face and where our arms, hands, and fingers are in relation to our nose. These exercises use the proprioceptive system. So first, I'd like you to place your right hand on top of your head. Tilt your ear towards your right shoulder. Focus your eyes in the opposite direction to the upper left and just hold this pose. You shouldn't feel like you're straining. Don't try to pull on your head or neck. Just notice the stretch in your neck and breathe. Hold the pose for at least 30 seconds. Notice your breath. and release it. We're going to do the same thing on the other side. Left arm, top of your head, tilt your ear, eyes to the upper right, the opposite side, and just breathe. You can soften your gaze, or you can stare at a fixed spot. Just notice the way your body feels. And release it. Good job. The next two exercises we're going to do use the same fundamental steps as the previous exercises. Place your right hand on top of your head and tilt your ear toward your shoulder. Take your left arm, put it around your rib cage, and as you tilt your head, gently pull your rib cage in the opposite direction. And your eyes go to the upper opposite. So we're tilting to the right, eyes to the left. Again, you shouldn't be pulling or straining. This should not be uncomfortable or painful. Just notice your breath. Hold it for 30 seconds. You may have some emotions or some thoughts come up, and that's okay. Just let them come and go without judgment. And release it. We're going to do the same thing on the other side. Left hand, tilt your neck, your ear towards your shoulder. Right hand around your ribs, eyes to the upper right. And just hold it and notice your breath. Feel the stretch in your neck. Let the tension go. You can lean in or pull as long as it's comfortable, but don't force it. And release it. Good job. Notice how you feel. These exercises can be done anywhere. You can do them in your home in a comfortable environment, sitting on your couch, sitting on the floor. You can do it in the break room. You can do it in your car. You can do it in any situation where you feel like you need to focus on your body and get out of an anxiety state. You might notice some emotions or some thoughts that come up, and that's perfectly okay. Just let go of them without judging them. Focus on your breath. You can hold the poses for more than 30 seconds. I do recommend, though, you hold them for at least 30 seconds. Thank you for watching this video.